Hello. Welcome to Right Side Broadcasting's live coverage of the House vote on the Obamacare replacement bill, the American Health Care Act. Supposedly any moment now, not sure exactly how to interpret any moment, but supposedly any moment now, they're going to be voting on this bill. Could be a couple minutes, could be longer than a couple minutes, but it's supposed to be soon. So we wanted to cover it for you live here at Right Side Broadcasting. We can't just show you the feed and play you all the audio on that. That we're not allowed to do. What we're going to do is we're going to have it over my shoulder, and we're not going to have the volume, but we'll describe to you what's going on and give you an update. So we wanted to give you some of the footage from it, but we're not legally allowed to actually just show the feed and let you watch it. So, and we do things, we don't steal footage and just put it on our network and show it to you and leave it up there like some other channels do. So, we're covering it. We have a human being, me covering it. We'll tell you what's going on, but we'll have like it over my shoulder so you can just see some visuals about what's going on, and we'll describe to you what's happening. When the vote happens, I'll be following along here. Jake Seals producing will be following along. We will give you a live update as to what's going on with this bill. Right now, over the last few minutes, I think longer than a few minutes, I'm not sure, I know longer than a few minutes, I'm not sure exactly how long, they've been in the House of Representatives. Different representatives are just going up and like putting in their 2 cents about the bill. So they speak for like a minute, but there's 430 some odd representatives in there, so that takes a while. I don't think they're all going up to speak. Maybe they are. But they're going up each for like a minute and saying stuff. So that's, as of a couple minutes ago when I got on air, that's what they were still doing. But soon that will come to an end, and they will actually vote on this bill. So we're keeping an eye on things, and we will let you know as soon as they vote on it, and look forward to bringing that to you. And hold on, I'm just going to move a little bit so I'm uncentered. Is that, let me know, Jake. Okay, thank you. So, all right. So, and if you want to write in, we're covering this on the air, but another reason we want to be on the air is we also want to give you a chance to say what you're thinking today about this health bill being voted on. Are you for it? Are you not for it? What do you think about them passing it today? Do you think there should have been more time to look at it? So write in. Let me know your thoughts. I'm at @Lookner on Twitter, @LOOKNER. You can also email me at steve.lookner@rsbn.tv. And let me know, I'd love to know what you're thinking about all of this. I had some thoughts I wanted to say to you. I first want to call up my email here. Just get it up. And, sorry, I got a couple of messages here. Sorry, I just want to make sure that these aren't for this. My email is here. Okay, my email is back. All right, we're caught up. So a couple of things I want to say about this. So first of all, this bill, let's just recap how we got here to this vote today. So as I'm sure you're aware, about a month ago, there was this initial version of the American Health Care Act, the initial version of the replacement for Obamacare, and the Republicans in the House, they were going to vote on it, and the vote was scheduled, and then like at the last minute they pulled the bill, and it was kind of embarrassing. And this bill that's being voted on today is a revision of that first bill. And it seems like there's like two main changes in this bill that allowed Republicans who didn't support it before to get on board now, especially the more conservative Republicans like members of the Freedom Caucus. And these two changes basically, these two changes between this bill and the first version of the bill, are both changes that take some part of Obamacare, which was an entitlement part, which was they both take some part of Obamacare where something was being given to people, and it says, we're going to make this optional now. We're going to make it optional. And the reason to do that is to let by making these entitlement parts of Obamacare optional rather than mandatory, the idea would be to bring the rates down for the average person, to bring premium rates down. So, change one in this bill is that in the original Obamacare, it said every health insurance plan needs to cover a certain amount of essential health benefits. There's a list of benefits, and every health plan has to cover all of them. In this bill that's being voted on today, it gives the states the option to offer plans that don't. It gives the states the option to allow plans to be offered that don't include all of the essential health benefits. So that's one change. The second change, big change between this bill and the first bill, is that in the first bill it said health insurance companies can never charge more to people for just having a pre-existing condition. So for example, if somebody has cancer, if they go to get health insurance, they can't be charged any more for their premium than a perfectly healthy person of the same age who goes to get a health insurance plan. The same health insurance company can't charge certain people more just because they have certain health conditions. Now, this bill that's being voted on today says the states have the option to pull out of that. The states have the option to no longer mandate that pre-existing conditions, that companies cannot charge more for people with pre-existing conditions, that health insurance companies cannot charge more for people with pre-existing conditions. So both of those options for a state allows a state to offer coverage that's different than, it allows a state to do something different than they were allowed to do under Obamacare. It makes it so that in that state, insurance companies can charge more to people with pre-existing conditions, or insurance companies can offer a plan that doesn't cover all these essential health benefits. And in theory, by doing that, if a state allows its insurance companies to do these things, that would, in theory, result in the average insurance premium from those companies to be lowered. Because if you don't have to cover all the essential health benefits, you can have a lower premium. If you can charge more to people with pre-existing conditions, then you can charge less to people without pre-existing conditions. So that's at least the idea here. But note that the only way these parts of Obamacare get removed is if a state actively decides to do that. The bill itself doesn't remove these two parts of Obamacare, the pre-existing conditions part and the essential health benefits part. The bill leaves those in. It just says states themselves can get rid of them if they want to. And it also says, now it doesn't say the state can just get rid of it, period. It says if the state gets rid of it, it has to, like if the state gets rid of one of these two things, it has to make other provisions. Like for example, if the state gets rid of the requirement that says you can't charge people with pre-existing conditions more, the state then has to somehow show that it's going to help out people with pre-existing conditions. So, but it really puts the burden on the states to decide whether they want to pull out of these parts of they want to get rid of these parts of Obamacare. And I actually think it's a very interesting move. I want to say in a way it's clever. Now you might think depending on what you think about the bill, you might think clever is a bad word. You might think it's like sinister or something. But basically, politically, I guess I'm saying politically clever in the sense of what it allows, perhaps the Republicans who got won over to this version of the bill like it, because what it does is the bill itself doesn't cut these two things out of Obamacare. It doesn't cut the pre-existing conditions part out, and it doesn't cut the essential health benefits part out. But at the same time, the people who vote for the bill can say, well, we kind of cut it out of Obamacare because it's no longer required. But then if people in a given state have their pre-existing conditions coverage go up, say people in a given state have a pre-existing condition, and then the state allows their insurance companies to charge more for that pre-existing condition. people in the state can complain and say, oh, my pre-existing condition coverage went up. Coverage for me went up personally. But then the Congress people could say, well, it's not our fault. Your state is the one who chose to get rid of the pre-existing conditions requirement. So it's like, in a way, it's sort of, it like hedges on a bunch of things, like it lets the Congress people say they're voting against these parts of Obamacare while at the same time not getting rid of them. And then it sort of shields them from blame, because if in a given state these parts of Obamacare are taken away, they could always say, well, your state decided that's what was best for them. So it's like, I guess you could say it's a way, this version of the bill is a way to offer some changes in Obamacare and in some sense, getting rid of some of the entitlement parts of Obamacare while still shielding somewhat the people who vote for it in Congress from some of the criticism. That's at least part of my thinking. That's a thought I had on why, like, Republicans would be willing to vote for this bill. Whereas I don't think a lot of the Republicans, or enough Republicans, would be on board if the bill just got rid of the pre-existing conditions part or got rid of the essential health benefits part. I think at that point, they might feel, well, we're going to get blamed too much for cutting out these parts of Obamacare that some people really like. So maybe they thought that giving the states the option was a way of kind of like saying they did something, but at the same time, they can't be accused of totally getting rid of these things because they're leaving it up to the states. Just a thought about how this whole bill, how it's structured with these state options, might have helped get this thing passed politically, if it indeed is going to pass. But at least it seems like it's getting more votes than the first one did. Okay, so we're waiting on, right now, the House vote on the American Health Care Act, the current version of it that's supposed to replace Obamacare. Now, to repeat, well, I didn't say this before today, but I've said this before earlier on the like in earlier days on the show. Just to go over how this works. Just because the House passes it doesn't mean the law changes. The House has to pass it, then the Senate has to pass it, and then the President has to sign it. And if the Senate, even if this bill passes today, the Senate's not going to pass this bill. The Senate will pass some version of this bill, which is watered down, I guess you could say, in some way, or certainly will be. If the Senate's going to pass a version of this bill, it's not going to be as agreeable to the people on the conservative wing of the Republican Party. The farther conservatives on the Republican Party are not going to be as happy with the Senate bill as they are with the House bill, and so. We don't know yet what the Senate bill will be, but it won't be this bill today. It would be something that's different from this bill. So if the Senate does pass a version of the bill, then a question becomes, can the House and Senate agree on a further compromise and then agree on that, and then they would have to vote on that compromise bill, and that's what would be sent to the President to sign. So this bill today is, even if there's a health care bill passed that replaces Obamacare, it won't be this bill exactly. How much it would change? Don't really know yet. But and that is a point where, I heard some people saying this morning, like, oh, these House members are like committing political suicide by voting for this bill because so many people are going to be in their constituency are going to be angry about losing these parts of Obamacare, and they're going to be angry about this bill. And my thought was like, and the criticism is like, they're going to be committing political suicide in 2018 and their constituents aren't going to want to vote for them. And my thought was, in 2018, I don't think these House members are going to be judged on this version of the bill. If a replacement to Obamacare passes, so let's say the House passes this bill today, then the Senate passes some watered down version of the bill, and then they compromise, and then some final bill is passed. What the House members are going to be judged on is the bill that passes. I mean, in my memory, I don't remember like people running for office being judged on like, you voted for this early version of this bill which passed, and that's what I'm judging you on. I'm not judging you on the actual bill that passed. People get judged on the bill that actually becomes law, not on some early version of it. So perhaps some of the House members are thinking like, look, and the House members are kind of torn because on the one hand, I think they know that some of their constituents do like a lot of parts of Obamacare and don't want it to see the entitlement parts of Obamacare cut. But on the other hand, they know that a lot of their Republican constituents want them to do something about Obamacare because they promised they would. So I feel like maybe their thinking is, we'll vote on this bill, we'll vote yes, and that'll satisfy the people who wanted us to do something and not nothing. And it might temporarily get some people really angry in our constituency because it gets rid of some parts of Obamacare that they don't like, or at least in a sense gets rid of those parts. But what we'll do then is the Senate will vote on some like more watered down version, and then we'll get together with the Senate, and the ultimate version will be more watered down than this, and then we'll vote that through. And when we vote that through, then the people who liked Obamacare won't be so angry at us anymore, and the people who wanted us to do something will be happy that we did something. So I see this as kind of like the vote today as like they're sort of, the House members might very well understand that this might get some of their constituents angry, these constituents who actually liked Obamacare. But at the same time, they might be thinking they need to do this today to keep the conservatives the hardcore conservatives in their constituency, get their support, and maybe think that they can win over some of the other people later with a more watered down final bill. Just a thought I had. So I just feel it's very simplistic to say and not accurate to say they'll be judged by the one vote they have today. This is a whole process. It's not just one vote on this today. House members, they vote on this today, and if they pass it, then they very well might have to vote on a compromise bill with the Senate, the one that's actually going to become law whenever that happens. And that vote will be more scrutinized, I think, in 2018 than this vote will be. This is just in the early version. All right, so that's some thoughts I had about this whole thing. I'd like to hear what you're thinking, and let me just check my Twitter here and make sure that they haven't started voting yet, as far as I can tell. Let's see here. Hold on, and I'm pulling up a little tracker here. I wonder if I can, you know what I'm going to do, actually? Hold on, if I could plug this in. I'm going to plug this in. And on my iPad here, I'm going to call up some video of the House floor just so I can see what's going on and then alert you when I see something change. So excuse me while I do this for 1 second. Can I get it up here? Okay, so I see Nancy Pelosi appears to be talking in the House in my footage. And I assume and Jake, is it like over my shoulder or something, just so I know? Okay, cool. So you're seeing that too. Great. Sorry, so I'm just getting this up here so I can... that's perfect. Wonderful. Now I can see what's going on. So again, we are awaiting this vote, this House vote, on the replacement bill for Obamacare, the American Health Care Act. We're covering it live. As soon as the vote starts, we will be telling you how the vote is going. I have my iPad here. I'm going to be watching it and reporting it to you. And I'd love, again, to hear, we would love here to hear your feedback on this. What are you thinking about this today? Are you happy they're voting on this bill? Do you want it to pass? Do you not want it to pass? Do you think it'll look anything like the final bill if they pass it? If they pass it, do you think the Senate will pass a bill? How different do you think it'll be? Do you think ultimately we will see a replacement for Obamacare? What do you think? We'd love to hear your thoughts. Direct message me on Twitter at Lookner, at Lookner, or email me at steve.lookner@rsbn.tv. Let me know. Speaking of which, let me just check here. And I'm doing a quick Twitter check because I want to make sure that there isn't any kind of late breaking news about this healthcare thing. I have some comments here. You can see Nancy Pelosi talking. And I want to read you some comments that she said. So she did say, John Bresnahan from Politico reports, she said so far, some of the things she said were, inequality and inhumanity, that is exactly what Trump Care has in store for the American people. And she also says, John Bresnahan said she's portraying this vote as a moral issue, not a policy fight. I reject the moral priorities in Trump Care. So this brings me to a comment I want to make. I often see arguments against any kind of revision of Obamacare that takes away some of the entitlement parts of Obamacare, like, for example, takes away Obamacare's requirement that people with pre-existing conditions don't get charged more, takes away Obamacare's requirement that all these essential health benefits be covered. And I see these criticisms as, like, they basically say, like, Republicans are heartless, these people will just die or get sicker without this health care, and Republicans are just, they basically say, like, it seems like they're saying, like, Republicans are passing this bill because they don't care about people dying or getting sick. And I remember, like, Jimmy Kimmel said that thing, like, he was talking about his son who had like open heart surgery, which is terrible, of course, but he said something like, if there wasn't Obamacare, then someone like my son couldn't get health insurance. So when people say these things, it makes it sound like that if you vote to repeal Obamacare or you vote to lessen the coverage from what it is in Obamacare, then you want people to get sick and you want people to die. And that's just not the case. Now, maybe there's someone who thinks that, but lots of conservatives who want Obamacare to be repealed, or who want a health system that doesn't cover so much, who want to not have health insurance have to cover so much, and want the insurance companies to have some more freedom on how to set their rates. A big reason a number of people want this, is that they just don't think we have the money to pay for all this health care. So I think most people I know, and I would say most conservative people, would love it if healthcare just covered everything for everybody. I don't think any rational person doesn't want, in theory, a health system where everybody's healthcare was covered totally. That would be wonderful. It would be a great world, and it would be something we could all wish for. But practically speaking, these things cost money. And what I like in all these criticisms that I've seen so much of lately, which basically say like the Republicans are heartless. If they pass this bill, these people will die who got covered before. What they don't explore is, what are the costs of Obamacare? What are the costs of mandating insurance that covers more rather than less? Because there are costs to that. You have the cost of the national debt, which keeps going up, and which, if we don't do something about soon, it's going to cause bigger and bigger problems. It's going to crowd out more productive investment. We're going to have no money left to do anything if we eventually have to keep paying more interest on the debt. Also, it's when you have health costs, when you mandate that health insurance covers a lot, then the premiums go way up, the deductibles go way up, and people are left in a situation where they might have coverage, but they don't want to use the coverage because the coverage costs so much to use. So there's these issues. So and I do think the national debt one is really important, because basically, I've been reading some articles about the national debt lately, but we do have really big problems in this country with all of our entitlement programs, where if you look at long-term projections and you look at the demographics of our country, where our country is getting older, and these long-term projections, things like Social Security, Medicare, Medicaid, I think right there that's like half the federal budget, if not more, Social Security, Medicare, and Medicaid. But those things are just going to cost more and more and more and more and more. And it's that's the projections. Unless we do something, those are going to go way up. And the interest on our debt is costing more and more and more. And it's a huge problem where that part of our budget is going to grow, and we're not going to have money for other things. And we might not even be able to pay for that. So it's something that needs to be dealt with, and it's not being dealt with. And there are conservatives out there who say, hey, Obamacare, yeah, we love the idea in theory of people getting more coverage, but we can't pay for it. And instead of spending more on our health insurance entitlements, we should be finding ways to spend less. So, and when you say that, you're not saying it because you want people to die and get sick. What you're saying is, look, I get that covering people with making health insurance cover less now and lessening health insurance entitlements. I understand that might hurt some people now, but there's a bigger harm to Americans in our long-term future if we don't deal with all these entitlement costs and if we keep spending money we don't have. And when you just present your argument as, oh, Republicans want to cut Obamacare, so they want that person to die. Or cutting Obamacare will kill these people. Or, that's how these arguments are presented. They totally ignore that cutting Obamacare might have benefits to people by cutting the debt and spending less money that we don't really have long-term to So it's not a balanced argument. It really frustrates me. And I feel like it should frustrate you no matter whether you're personally for or against Obamacare. No matter where you come down on the issue, you should want dialogue about it to talk about both sides of the issue. And I just feel like it's incredibly simplistic and a bad argument to say, you shouldn't want to cancel Obamacare because Obamacare is covering this person and they'll lose coverage if you cancel Obamacare. Fine, they'll lose coverage, but a lot of conservatives would totally acknowledge that, and I think most rational conservatives would acknowledge that, and they'd say, we wish we could give them coverage, we can't pay for it. So I get frustrated with how the arguments against repealing Obamacare or against this health care bill are presented. Okay, I went on a little rant, but fine. I felt strongly about it. I want to hear what you think about this. So we're waiting for the House vote on the Obamacare replacement bill. It's supposed to happen very soon. I want to say any moment now. But, that's we've been hearing for a little while. But I assume, actually, because Nancy Pelosi is speaking now, maybe she's the last Democrat speaker because they wouldn't have in theory, they might save her for last. So maybe when she's done, they will have the vote. We will bring it to, we will track it for you live here. We'll tell you what's going on with the vote. And I want to hear your thoughts. So a couple of people have written in. If you'd like to write in, give me your thoughts on this whole thing, on what's going on with this health care bill, on the vote, on the replacement bill. Let me know. Write to me on Twitter @Lookner, @LOOKNER, or email me at steve.lookner@rsbn.tv. Okay, Gossamer writes in, Steve, does this bill introduce proper national free market insurance reform, or is out-of-state competition still restricted? So, my understanding, Gossamer, is that the Trump administration wants to open up health insurance so that insurance companies can sell health insurance across state lines, but that can't be included in this bill. I think, I'm not sure, I think the reason it can't be included in this bill is because this bill is being taken through Congress on this special budget reconciliation procedure, and I believe that affects what can be in the bill. Now, maybe I'm wrong about that specific thing, but I haven't looked this up in a while. But also, I do know that the Trump administration has said that part of the bill is going to be dealt with. That part of health care reform would be dealt with in terms of by the executive branch in terms of regulations. So they're saying that, oh, I'm sorry, I might have said something wrong. I'm sorry. Let me take this back. Forget the budget reconciliation thing. Now I'm remembering, and my vague memory is that there's something in the actual Obamacare which leaves it, which makes it a regulatory issue of the executive branch and not an issue of the actually what the law says as to whether there will be out-of-state reform or not. Yeah. So basically, I think what has to happen is I'm giving you a meandering, unclear answer to your short question. So the quick answer to your question is it's not in the bill, but that's because where the administration is saying this change will be made is not in the language of the bill, but it will be dealt with by the executive branch. I believe maybe the Secretary of Health and Human Services, Price, he would be the one who would do certain things to open up the state line stuff. but it's not something that's dealt with in the bill. As to whether that also has related to budget reconciliation, I'm not sure. I think maybe it's just that. So the short answer is that no, it's not in the bill, but that doesn't mean the Trump administration doesn't want to make this change. Their plan is to make this change, but do it via the executive branch, via changing regulations or between changing regulations, not by having specific language in the bill. So that's my answer to your question, Gossamer. I know that was longer than I thought, but hey, I didn't know that question was coming, so I was trying to remember stuff. I see Paul Ryan is now up there speaking and at the House, and so I'm assuming the vote will be quite soon, but we will keep our eye on it and let you know. Connor Wells says, hello, Steve. I believe the House will pass the bill, but I believe the Senate will not. I think that President Trump needs to focus more on other issues such as the tax reform and immigration. Thanks, Connor, for writing in. So you think, Connor, that the Senate won't pass any version of this bill, which you might be right about that, and you think that President Trump should be focusing on other issues such as tax reform and immigration. So thank you for writing in. Now, a couple things here. One thing is, perhaps President Trump is thinking, well, maybe we got to do something on health care either way. Either we have to pass a bill or have it fail. But that way, maybe he might think it was such a big promise to get rid of Obamacare from myself and a lot of people in Congress, Republicans, that we have to look like we did something on it. Or maybe President Trump thinks the Senate really will pass a version of the bill. But I'm just saying, so President Trump could share your view of wanting to move on, but think that, President Trump could share your view, and I'm guessing he does, that tax reform and immigration needs to be dealt with. But he might think that this needs to be dealt with first, whether it succeeds or fails. But and we'll see, how long this takes. But I understand your concern, which is you feel that this bill is ultimately doomed, and if it's doomed, why spend the time on this? It could be spent on these other important issues. Thank you, Connor, for writing in. Miss Tree says, I believe anything Trump does will be done in time. Rome wasn't built in a day. LOL, God bless. Thank you, Miss Tree. So you think that, I think you're thinking that this bill might actually end up leading to a repeal and replacement of Obamacare, whatever ultimate form the bill is in, but we have to be patient. And, Ms. Tree, it is a good point, because remember a few weeks ago when the original health care bill was going to be brought to a vote, and then it was pulled out at the last minute. It was pulled off at the last minute. Pulled off, pulled out, pulled away. What's the phrase I'm looking for? Pulled off the table, maybe. Withdrawn. It was withdrawn at the last minute. And a bunch of commentators were saying, this White House can't do anything right. Trump doesn't know what he's doing. The administration's all messed up. Reince Priebus doesn't know what he's doing. Steve Bannon's messing everything up. And, it was as if we were in store for 4 years of nothing happening. And just a few weeks later, and I didn't hear a lot of people really predicting this, we're on the verge of having a House vote and the House passing this bill. So that's another thing to keep. That it's it's consistent with your point, Ms. Tree, which is these things don't necessarily happen fast, and maybe going through the first part maybe going through that first version of the bill where it had to get withdrawn was necessary to get to this point today, where the bill seems close to passing. But it's worth, because, with these 24-hour short news cycles, everybody wants to make sweeping judgments about things right away. And I think it's good to have a more longer-term outlook on how things are going and what might happen. So thank you, Ms. Tree, for that. If you... Ryan is speaking, yes, so you can see Ryan speaking. And just to let you know again, for those of you who might have tuned in recently, so we're not allowed to just put on the air the House floor proceedings and have you hear the audio of it. We would if we could, but we're not allowed. And unlike some channels, we don't do things we're not allowed to do. So what we're doing is we're giving you coverage. We're showing some of the video of that over my shoulder just to give you some of the flavor of it. But we're not going to play the audio for you. And I will describe to you also when the vote starts. We will count the votes and we'll let you know what's going on with the vote, and you'll be able to follow along. And before that, though, we're also taking your comments and your questions and your thoughts. So I'd love it if you wrote in and share with me what you think. I've spoken enough. I want to hear what you think about all of this. Whether you're for the bill or against it, what do you think about the strategy of voting on it now? All these questions, so many things we could talk about. Do you think the Senate will change it a lot if it passes today? Do you think it'll even pass today? Write to me at Lookner on Twitter, at LOOKNER, or email me at steve.lookner@rsbn.tv. And if you enjoy our coverage, if you enjoy, really quick, our coverage of events like this, we give you an alternative to the mainstream media. We want to give you something different where you can turn to. Hope you consider donating, because we rely on your donations to stay on the air. Your donations are by far the large part of our operating budget. It comes from your donations. That's where it comes from. And so if you want to donate, you can go to rsbn.tv/donate. That's rsbn.tv/donate. Or we have a thing where you can give a monthly donation and actually get like cool stuff from Right Side Broadcasting for free in return. And as a reward for your donation, that's at Patreon, www.patreon.com/RSBN. Or, really easy way to donate is if you're watching on YouTube, you can click the $ at the bottom of the chat room and you can donate that way. Very easy. Thank you to the moderators for moderating the chat today. Always appreciated. Okay, we have a message here from... I did have it. I think it's from Francis. Sorry, if I could use my email right, I would actually let you. Francis Purcell writes in, Francis Purcell 20. I think the new healthcare bill will ensure that you will need to work for your care, and I think it won't just be given to you. I'm not sure about this part of the bill. I haven't heard about this specifically in this version of the bill. But that's not to say something like that is not there. Also, the Senate's going to have a version, and there'll be a final version. So this is something I'm not aware of, Francis. But and you might also be talking about what the final version might look like. So thank you, Francis, for writing in. If there's a more specific place you were referring to, please feel free to let me know. I need to do a Twitter check here. Oh, I think we got another message. This is from Andrea O. Andrea O says, I appreciate your insight into different issues. I always come away with a better understanding. RSBN is the best. That is very nice of you to say, Andrea O. I really appreciate it. And, Andrea O, we don't want to, at Right Side Broadcasting, tell you what to think. We want to just present information to you, and we want to let you decide what to think. And we think that the America is a better place when the citizens are better informed, and they don't just blindly take opinions. They think they consider arguments on all sides, and they critically think what would be best for the country. So we want to present you with all kinds of information here and let you decide. So thank you, Andrea. We try to inform. Ryan writes in. Ryan says, when the Senate negotiations start, Mike Lee, Rand Paul, and Ted Cruz will get changes, and I reckon it will get popular among Americans. So you think that, Ryan, that the Senate will make some changes to this that will make it, I think you're saying, people who aren't on board with this House version of the bill, some of those people might get on board once the Senate makes some changes. So we'll see. It's an interesting thought. And I'm going to take a drink, but also as I take a drink, I want you to notice something. Ooh. What's Steve drinking from? It's a Right Side Broadcasting mug. And actually, this is one of the things you can get if you... Jake, these are available to Patreon people, right? Subscribers? Patrons? Yeah, so this is one of the things that if you want one of these, you can go. This is one of the gifts we give people who subscribe, who are become. Oh, showing through the green screen like it's invisible. What? No matter where I hold it. Oh, all right. Well, it's not actually an invisible mug. That would be pretty incredible. It's supposed to be white. It's white, and the logo is blue. Can they see any of it, Jake? Okay, well, it's a white mug. It's not invisible, though. But if you want to get one of these, it's one of those gifts we give out to our Patreon subscribers. So check out www.patreon.com/RSBN. You can make a monthly donation, and you can get stuff like this, like that mug. Okay, we are waiting for the vote. It's supposed to start very soon. So We saw Pelosi spoke, Ryan spoke. I have to imagine it's almost time to vote there. Let's get it on. Let's vote this. So, and we're going to, when it comes on, we'll give you the live vote count here and let you know how it's going. But while we're covering it, I'd love to hear from you. I'd love to hear from you. So write me at Lookner on Twitter or email me, steve.lookner@rsbn.tv. Let me know what you think about the vote today, where you think this bill is going. What kind of, do you think the Senate's going to change it? Do you think it will ultimately pass? Some compromise bill will pass? And are you unhappy with this version of the bill? Do you want Obamacare to stay? What parts of it do you like or don't like? All these things, let me know. Oh, they are coming on the screen. So they are voting now, Jake? So it looks right now, I have word from Jake, that some voting numbers are starting to appear. I am following a live vote count online. So I'm going to bring you updates from that, and that count shows nothing yet. So we're going to cover this all for you and let you know. Oh, let's see. Now, Jake, so I have this in. This first vote is on the McSally legislation to get rid of the lawmaker health care exemption. It's a separate item. So just so you know, that's from Jamie Dupree is reporting that. This vote that's going on right this second, if you look on your screen and see some votes, like if you're watching on a different channel, that's not on... And Jake, on our channel, is the video, does it show some votes on the screen? Yeah, so that's not on the AHCA. It's an initial vote, but it's not on the bill itself. It's just so you know, they're not voting on that yet. Jim Acosta from CNN reports the White House is bracing for a healthcare squeaker. Could pass by just 2 or 3 votes, one official said. That's what Jim Acosta says. I am looking for some other updates here. So to repeat, they are not... Wow, President Trump just tweeted out. He just tweeted out, insurance companies are fleeing Obamacare. It is dead. Our health care plan will lower premiums and deductibles and be great health care. President Trump just tweeted that out. He just tweeted this out 30 seconds ago. That has to be intentional timing. He must have been waiting till right before the vote starts. Now, did he do this to maybe influence any last-minute wavering lawmakers, or did he do it just because he wanted to talk to the American public right at this time about this vote that was about to happen? Really interesting timing. So, President Trump with a tweet there. Let's see here. I'm just trying to get some more updates for you about what's going on in the House right now. Well, you know they're having like an initial vote, but it's not on the actual bill yet. Everybody's just waiting now, waiting for this vote. All right, we're waiting with you. We're waiting with you guys. We're going to watch it. I'll be a little disappointed if they do these initial votes and they take like an hour and then they get to the vote, because we've been told all day that, at least by the news networks, that this was coming up very soon, and a lot of other press that I saw. So I hope they weren't lying to us about when the vote's going to happen. This is a tweet that just came out from Rich Lowry. Rich Lowry writes, conservatives wanted to repeal regulations. Moderates didn't, compromised on letting states get waivers. Senate Republicans could use a similar mechanism on money, other problems. So, and I think Rich Lowry is saying something smart, and it's similar to something I was saying before. Well, it's not exactly, it's a little bit different than what I was saying, but the idea here, what I was saying before, is letting the states waive certain parts of Obamacare is like a compromise. Because it's not getting rid of those parts of Obamacare, but it's not requiring them. And it kind of pushes it off on the states. And what Rich Lowry says is he says that it was a compromise between conservatives and moderates in the Republican Party, and that conservatives wanted to get rid of these certain parts of Obamacare, but moderates didn't. And so the compromise was to let the states be able to waive them if they wanted to. Now, I actually also think, though, in addition to any kind of compromise between conservatives and moderates, I think it was a compromise for the individual members, because it lets them say to their conservative base, see, we got rid of these things. But it also lets them say to their people, like especially if they're in like a tough district and a close district, they can say to like the people in the independents and the Democrats who might vote for them, they can say, well, we didn't totally get rid of these parts of Obamacare, we left them in. And maybe they live in a state where they think the state won't take advantage of these waiver provisions, so they can say, see, my constituents, you still have all the stuff that you had under Obamacare, or a lot of the stuff. So that whole let's not take stuff out of Obamacare, let's let the states have the option to waive it. That was like an important part of this version of the bill. Josh Dawsey reports from Politico, they are rolling cases of beer into the Capitol and coming to the White House afterwards for a celebration. Kind of remarkable so far to go. I don't know what he means exactly by so far to go. Oh, I think he means so far to go like the thing hasn't passed yet. So that was from Josh Dawsey. And again, would love to hear your comments. Let me know what you're thinking today. Give me a shout. At Lookner on Twitter, at LOOKNER, or email me at steve.lookner@rsbn.tv. I also want to sort of see, Jake, I wonder if I can pull up the chat here. That might be too much, though. I don't think I'm going to be able to do everything at once on my iPad. So if you're in the chat, I can't see what you're saying. So if you want to say it to me, please email me or write to me on Twitter, because I'd love to hear more of what you're saying. Okay, and I'm seeing also one of the news networks saying House votes soon. And once again, the vote that's on the screen now, you see numbers for, that is not on the replacement bill itself. It's on something else. Let me just call that up here. So that'll be done soon. And I'm seeing now CNN is also reporting that the House GOP is supposed to go to the White House after the vote today. So I think President... Yes. Oh yeah, that's fine if people are okay with that in the YouTube chat. So as long as they're, you know, as long as maybe just say to the chat like, hey, your questions might appear on the air. Are you, you know, if you ask them here. So we might hear some questions from the YouTube chat. So I'm wondering, President Trump is supposed to go to New York City today, but I'm wondering if he's still at the White House, because if he's, well, so we've heard that the House GOP is supposed to go to the White House if they pass this thing today, right afterwards. So will there be some kind of special appearance, perhaps, with President Trump and people from the House GOP at the White House, and will that be televised? Don't know. If this passes, it hasn't passed yet, by the way, but we'll keep an eye out on that. President Trump is supposed to go, oh, I think he's still at the White House. He's supposed to go tonight and speak at the Intrepid Museum, which is an air and space museum right on the river. I think it's on the Hudson River of Manhattan, not on the East River, or is it on the East River? No, I think it's the Hudson River. So he's going to be going there tonight to speak there. See, I don't believe he's left that, and that's not a long flight.
Steve, we have a question from Swoosh for Trump. Asks, what does Prez mean next to the nay column?
Oh, you're looking at I think you're saying right now, you're seeing on screen a Prez next to the nay column. Let me look at that. I don't know. I wonder if that means present or something like that. Let me see if I can find out, Jake. You know, I'm finding out. I'm just saying Prez next to nay column. Like, does it mean president hasn't and not voted yet?
I believe that means presence, yes, or present.
Let me see if I can find an answer for you. I can't find one quickly, but that was it's a very good question, and I'm not sure. I'm not sure. No, because NV says, NV I would think it means not voted or no vote. But I don't know. Now, PRES could also mean like the vote's been presented but not announced or something. That could be the case. I don't know. That's a great question. Can't tell you.
I'll take one other question that's not quite relevant to the situation. Well, it is in a way. Francis Purcell asks, how long have you been on the air, Steve? Which I assume is how long have you been doing this kind of coverage stuff?
Well, for political stuff, just since I started here in December, and so I've been doing it since then. And I did a couple little other TV things, which will go unnamed years ago. But here, just since December. Thank you for the questions. I'm going to check my Twitter feed and make sure there's not more questions there. Thanks, Jake, for passing those along. So we're just waiting for a vote. We are waiting for a vote. Let's see. Now, SH7401 just sent me a text that said, OMG, Le Pen was just attacked with eggs. Or SH7401 sent me that on Twitter. Let me see. This is from Breaking News Live.
Metro also asked when you get a chance to show the mug again, please.
Okay, I will. So, thank you, SH7401, for the heads up. Breaking N Live, which I follow on Twitter, is reporting, this was reported this morning, like an hour and a half ago. Le Pen was attacked with eggs, and they have a video of her. It seems like maybe getting hit with the egg, but it's not so clear. But if you want to see that, go to Breaking N Live. And Susan J, you sent me a thing that said still counting, but it was from I think the clip you sent me was not from this vote. I think you took a Senate clip, but the vote today is in the House. So, or you might be referring to the vote going on right now in the House, but that's not on this bill. So they haven't voted yet on the actual bill yet. We are keeping an eye out for that. And this is, and to repeat, thank you, Jake. So this, what was being voted on now was some kind of thing, and I don't know exactly what it is exactly, but it's some kind of thing where like, I think it's something like Congress people wouldn't be exempt from this new health care bill or something like that, but it wasn't the health care bill itself. So, and that is passed, but I don't even know exactly what it was, so I can't really say. Let's see here. Trump schedule update. According to Jennifer Jacobs, he was supposed to leave the White House at 1:45 today. He's leaving at 5 today. It's been changed. So perhaps that change is because President Trump thinks this bill is going to pass, and maybe he wants to meet with the House GOP and do some kind of celebration or make some kind of statement. If this passes, we may very well see a statement from President Trump. I could imagine some kind of joint President Trump, Paul Ryan statement, in the White House or something. We'll see. I would have to imagine that if this bill passes today, President Trump would take the opportunity to make a nationally televised statement about it. I would just have to imagine. Maybe I'm wrong. All right, Deplorable Sonny says, I fall in the category of losing health care. Is prescription drug costs going to be lowered in this bill? So I'm not sure what you mean by I fall in the category of losing health care exactly, Deplorable Sonny. Feel free to write back and clarify. Is prescription drug costs going to be lowered in this bill? I am not aware of anything specific in this bill right now that makes like a big effort toward lowering prescription drug costs. Now, I might be wrong about this, but I'm not aware of any kind of big part of this bill that specifically addresses that. But I don't know. And maybe there could be, if it's not in this bill, it could be in a future bill. So that's my best answer for you. I don't know everything in the entire bill. I just know the main big points. So I like to think I know the big.
Donald Trump just tweeted, President Trump tweeted, if victorious, Republicans will be having a big press conference at the beautiful Rose Garden of the White House immediately after vote. This came, and I confirmed it independently, this came from Categoric Team in the chat.
Yep, and thank you, Jake, very much. And Jake, people can hear you when you're on, right? Yes?
That's correct.
Great. Thank you, Jake, for that update. And I'm looking at Donald Trump's Twitter myself. And just as we were talking and speculating about what would happen at the White House, he did tweet that. And so I want to repeat that, Jake, thank you to the person in the chat who gave us a heads up. Trump tweeted, if victorious, Republicans will be having a big press conference immediately at the beautiful Rose Garden of the White House immediately after the vote. So we were just speculating about that. And if we can, Jake, we'll broadcast that live. Hopefully it'll be carried somewhere where we can broadcast it live, but we'll see.
We should be able to.
Hopefully we can. So thank you, Jake, for letting me know. Kerry Nelson writes in, Prez on the screen when they're voting means the representative was present to vote but did not vote either yay or nay. Does that mean maybe they abstained? So I guess an abstain, would that be abstain? I don't know. Kerry, thank you, though, for that clarification. I still would like to know what it means to vote but not vote either yay or nay. Does it mean abstain? Okay, let me just check my Twitter here and get more updates for you. I'm looking here. And, you know, I have to imagine that if it does pass, the atmosphere in that press conference in Rose Garden will be quite celebratory. And let me say this. If this passes today, even if ultimately no health care bill does pass both the House and the Senate, it is a significant moment in President Trump's administration. This would be the first big piece of legislation that passes one of the houses of Congress under President Trump. That's a very significant moment. He's never done this in his life. He has never, as president, overseen and helped shepherd through a bill in one of the houses of Congress that actually passed. So I would think that for President Trump, it's a very significant moment. In the same way, if you remember the New Hampshire primary, he really seemed deeply emotional and affected right when he won that. When he won that first primary, it was the first time he'd ever won a primary before, and he really seemed like very deeply affected by that moment. It was like, wow. I could see this being similar today, you know. And again, it's regardless of whether this bill ever becomes law, just the fact that if he does it, he'll have gone through all this work and personal expense of his time and effort to get this passed. And that's probably, first of all, personally seen as a personal accomplishment for him by himself. But also, you know, there's been a lot in the press about a lot of criticism about how incompetent this administration is and how they can't get anything done. And it would be a milestone for the administration to get even just this passed, even if it doesn't become law. So I could imagine him having some strong feelings and having a celebratory environment in that press conference if this passes.
Thomas in the chat room asks, have any Democrats publicly supported the repeal replace bill?
Okay. Have any Democrats publicly supported this bill? Great question, Thomas. I am not aware of any who have. Doesn't mean they haven't. I'm not aware of any who have, but a very good question. And I want to take a drink of water, but I was also told somebody wanted to see the mug again. Now, this is the mug. Jake, if I like hold, can I hold something behind the mug, or that doesn't make, no, because it's my iPad, does that work, or is it just, it's reading green on the white, right? Is that what's happening?
So is your iPad.
Yeah. So it's something about the white. It's so this is the best. I'm holding it up. Why doesn't white? This is so sad that they can't see the mug, Jake. Why is this happening? Is it? Do you think maybe the mug is like ceramic, so it reflects the green from the wall or something?
Yeah. If you take a picture of it, I can put it up on the screen.
Oh, let me do that.
Send it to me.
Hold on, Jake. This is so technological, what we're doing right now. So I'm going to take a picture of this. Should I take a selfie?
Sure.
Hold on. Oh, wait. Oh, the light fell down. I got to replace that. Oh, that's it. All right, Jake, I'm sending this one to you right now. Hold on. I don't like this is like the thing they do on the Oscars when they take a selfie and then they send it out, but I'm doing it anyway. Here we go, Jake. All right, Jake, I am sending this to you now. Just send it, Jake, and you can post it. And let me fix this light, which I just knocked down. Put that over there. Wonderful. Okay, we have some messages I want to get caught up on. And they're not voting yet on the bill, just so you know. They're not voting yet. They're voting soon. Kerry Nelson. Oh, you wrote in, Kerry, so I already said that. Aaron Robinson says, yes, Steve, pres means present and essentially means an abstention. Thank you, Aaron, for that clarification. Paul Spalding writes in, I'm a disabled vet who has been deemed unemployable through the VA. I have an autistic boy and daughter, both in which get state Medicaid. My wife, however, does not because I make too much on my untaxable income, so we need something she gets help with. I hope it passes. So it sounds to me, Paul, first of all, thank you for your service. Second of all, it sounds to me like you're saying you hope this passes because you think this will help with your specific issue. So I'm not clear yet on exactly how you think this is going to help your issue. I know you think it does, so if you want to clarify that, you can. But the basic point so I don't want to say something that misrepresents you. So what you are saying is you hope it passes because you think this will help your specific issue. I'd be interested in knowing why you think that, Paul, if you want to clarify. But if not, I'm perfectly happy just reading that comment. So thank you for your service, and you hope it passes and you think it'll help with your issue. Now, you're saying, Aaron, C-SPAN is showing this as final passage of the health care bill. But I will say, like CNN, for example, it says House vote soon. And also, from the other press I've been reading, they haven't been reporting it as that yet. But we'll keep an eye on it.
I'm going to show the mug now.
Oh, great. The mug is being shown.
It's a great picture. I mean, it's just fantastic, really.
No, I don't know about great, but it does show people the mug. So that's the mug you can get. Go to www.patreon.com/RSBN. You can get stuff like that if you want to donate monthly to us. Go to that Patreon site and you can check out how to get the mug and other stuff, other cool stuff. Also, if you want to donate, again, we rely on your donations to stay on the air, to do coverage like this, to give you an alternative to the mainstream media. So if you would like to donate, we'd really appreciate it. Your donations keep us on the air. You can go to rsbn.tv/donate. That's rsbn.tv/donate. Or you can just donate when you're watching on YouTube in the chat room. You can click the $ below the chat room, and your donation will actually pop up in the chat room, and I can thank you on the air for it. So thank you in advance and for all your donations that you might give. And thank you to everybody who's donated so far, who's allowed us to be on the air today. Jake, I'm hearing myself a bit in my earpiece. That's better. Okay, we have some more messages here. Noreen Sanderson says, the number in the press NV column goes down as the yay or nay column goes up. Yeah, so, you're saying, so NV is not voted. So my guess, Noreen, is that when somebody not voted goes down by 1, and then when not voted goes down by 1, yay or nay would go up by 1. But you're saying the numbers in both press and NV go down as the yay or nay goes up. So that would suggest that press doesn't mean abstain. Because if press meant abstain, then press would never go down. Actually, yeah, because I think I saw press go down. So if it was abstain, that wouldn't mean go down. I mean, maybe press means they've presented their vote, but it wasn't counted as a yay or nay yet. I don't know. This is a great question. I can't tell you. Oh, I see. C-SPAN, Susan J., you say, are showing right now the Senate voting on the federal spending bill to avoid the shutdown in September, and they're showing that it's passing. They showed that it passed. Thank you, Susan J., for clarifying. David Brown says, if this bill fails, I say let Obamacare fall on its own. Of course, it will hurt the public, insurance companies, states, etc., but politicians will pay. So you think the Democratic politicians will pay, you think, David, if Obamacare fails. Thank you, David, for writing in. So you think, again, to clarify, David, if this bill fails, they should just give up on changing health care and move on to something else. And then, I think you're saying that the Democratic politicians will suffer if Obamacare stays in place. 13th Colony writes, prices are so high just because Big Pharma can charge insurance that much. Real Donald Trump will have a long chat with Pharma soon. Thank you, 13th Colony. You think that President Trump will have some kind of chat with Big Pharma to get these rates down for prescription drugs. I've seen different proposals about this. I've also seen something that says, like, I want to say, like, I need to reread this, but something like some of the government programs are allowed to negotiate their drugs and some of them can't. Like, I think the VA, perhaps like the VA can negotiate drug prices, or the Medicare can, but the government can't negotiate, or maybe it's like Medicaid can't negotiate their prices as a whole with the drug companies, and they just pay whatever the drug companies charge, but the VA program can negotiate. So there's some stuff like that. I need to go reread this stuff again. But there's also proposals out there for how drug prices could be lowered, in addition to, President Trump saying something they're trying to work it out directly with the drug companies, but we'll see what happens. NV means they are not, Kerry says, NV means they are, Kerry Nelson, NV means they are not voting because they are not present to vote, meaning they are refusing to do their job. Now, I will say this, Kerry, we could imagine reasons for them not voting which aren't them refusing to do their job. For example, let's say somebody had a medical emergency and they were in the hospital and they couldn't get there to vote. That would be, you probably wouldn't call them not doing their job. Now, I know one representative today had a family emergency and said they couldn't be there because of that. And so I know that Jason Chaffetz had missed voting yesterday because he had like foot surgery, but I think he was going to try to get there today. We'll see. Thank you, Kerry. Aaron Robinson says, perhaps the people, he says, he was speculating that the people in the Prez column could have abstained first and then changed their mind. He also said, I thought the House already passed the budget bill yesterday, so how could this have been on what? So what happened is C-SPAN was showing the Senate vote on the spending bill that the House passed yesterday. And the Senate passed it today, so we're going to have no government shutdown. That's what was happening. So the House is voting soon. Hey, Jake, I'm wondering, could we maybe go like full for a minute with the video of the House with silence or music, and I could take like a 1-minute break and then I'll come right back?
I'm sure we can do it for a minute.
All right. So what we're gonna do is I'm gonna take a 1-minute break. We're not going anywhere. We're gonna show you the video of the House. And maybe we'll play some of Jake's music or something, and over that, and I will be back in a minute here live, and we're just waiting for this House vote. So I will be right. Jake, let me know when we're full, and then I'll come right back.
Go ahead.
All right, I'll be right back.
Don't talk about Texas or Amarillo skies. Don't talk about Houston or them Austin City nights. Don't talk about Galveston or sweet, sweet Abilene. Don't talk about Texas. Hey, mister, can I bum a ride? Anywhere you're gone is fine, as long as it's out of town. I could even fill your tank as a way that I can say thanks. I'm feeling kinda down. We can talk about anything that you want to, except one thing, mister, I'm begging you. Don't talk about Texas or Amarillo skies. Don't talk about Houston or them Austin City nights. Don't talk about Galveston or sweet, sweet Abilene. Don't talk about Texas. That's where she said goodbye to me. Well, I remember when she fell in love with me on that Corpus Christi beach. It felt so right. And I remember how her green eyes used to shine, and a taste on her sweet lips was like cherry wine. We can talk about any state that we've been through, except the one where I hitched this ride with you. Don't talk about Texas or Amarillo skies. Don't talk about Houston or them Austin City lights. Don't talk about...
Welcome back. I owe you an apology. We have some breaking news. Oh, I know what happened. Oh, this is all my fault. This is very embarrassing. First of all, the breaking news is the House just passed the bill. Now you might say, Steve, you were telling me they weren't voting on it yet. I'm literally going to tell you what happened. I had video footage on the side of, in the corner of my iPad, so I was watching it as it went along here and keeping an eye on what was going on in Congress. And then about 10 minutes ago, apparently what happened, and I didn't notice it, is that my video froze. So whenever I looked down, I would see House vote soon, and they had already started voting, and I totally blew it. So the House did vote on passing this. I totally apologize. I thought I was watching live coverage, and I was watching a frozen little screen in the corner that said House vote soon. So the vote on this, I'm so sorry about this. I feel like a total idiot. It was 217 to 213. That's what happened. I'm so dumb. It was 217, 213. It passed by 4 votes. They have passed the replacement to Obamacare, at least the version of it that they were going to vote on today. And so now what's happening, now the Senate the Senate will discuss a version and see if they can pass a version of this. If they pass a version, the two houses will get together, try to reach a compromise, and see if they can vote, and then they'll both vote on that compromise version. And presumably if they pass it, President Trump will sign it. So again, this is one of these things. I've never done live coverage of a vote like this before. Next time we do one, I will not make the same mistake again of being sure that the video hasn't frozen on my iPad. So this vote happened. It was 217 to 213. The Republicans have passed the bill, the American Health Care Act, at least the version of it that they voted on today. Now,
Keck King, I want to jump in. Keck King asks, does Lion Ryan have any say in this new bill?
Does Lion Ryan have any say in this new bill? Well, I'm guessing Paul Ryan was a big part of formulating the bill. So I would say he has that say. But that's probably the best. I mean, I'm guessing he was working on it. President Trump was working on it. House Republicans were working on it. So a lot of voices in bill that all people could, 217 Republicans could vote to pass. So they got it passed. And now supposedly, as President Trump said, there's going to be some kind of press conference in the Rose Garden of the White House. Republicans in the House are heading over to the White House now. We're going to try to cover that for you if we can. Gossamer says you need some monitors in front of you to look at. Yeah, look, this is one of these things where we don't have a lot of money here. We do this on like a shoestring here. In the perfect world, we'd have a bank of monitors, and we'd have an extra producer, like 3 extra producers to be watching everything. I mean, Jake is trying to just have the broadcast go on the air. So we're trying our best. And yeah, Kerry, you already wrote me, but I see now a bunch of you were writing me in. And saying, hey, the bill passed. But as I just said, yes, I'm aware of that, and I apologize. As I said before, I had the video on my screen so I could see exactly what was happening, and about 10 minutes ago, the video froze, and I think 10 minutes ago, and I couldn't tell that it froze, and I looked down, I kept saying they're going to vote soon on it, and I was like, what's taking them so long? And now I realize the video froze. So, my fault, it's terrible. GSB.UK says, Steve, you're fired. I understand your frustration with me, GSB.UK. So it won't happen again.
Steve, you're not fired, but Francis Purcell asks, Steve, are you happy about this?
Well, I think, am I happy about this? I want to see what the final bill is. Here's my thought on health care. My basic thought on health care reform is, I think the real problem of healthcare reform is that we in the United States pay more for healthcare than other countries do, and we don't get better results. And like certain procedures cost way more in this country than they do in other countries. And I think when the Republicans and the Democrats propose their various healthcare bills, what's not a big part of them and what we really need to address is the cost of health care overall. The Democrats and the Republicans really fight over who's going to pay what share of this giant pie, and the pie is all the expenses. Whereas I think the biggest issue is how to get the pie smaller, because the pie is big and it's growing and it's bigger than other countries. So what frustrates me is that Congress as a whole doesn't spend more time addressing the issue of how do we lower healthcare costs in general. But in terms of whether this specific bill, am I happy or sad that it passed? I guess I think I'm happy to see that the Republicans that Congress is functioning and that they can pass a bill. But in terms of healthcare itself, I think the big bill is going to be the compromise bill, that now that this bill is passed, let's see what the Senate does. Let's see what the House and Senate settles on, and let's see what that bill looks like. But I think ultimately my worries are more long-term, and I worry that we're still in the land of ultimately worrying about who's paying for what part of all these healthcare bills, and not worried so much about the fact that overall health spending is a lot. It's way more than in other countries for no better results, and it's growing. So I'm hoping some more attention gets paid to that. Oh, and we're going to take calls, I guess, now too. And I just want to, so if you want to call in, you can call 202-470-0049 and call in. Let me just say, no one's more upset about me not realizing my screen was frozen and missing the actual, and not being able to narrate the live vote of the bill for you than me, because I like that more than anyone. I enjoy seeing it, so I'm bummed that I didn't notice when they were having the vote.
Everybody in the chat room is saying you did nothing wrong, Steve.
I'm angry. Well, I'm upset myself that I didn't get to see it, so I apologize. It won't happen again. But anyways, thank you, Jake, for saying that. So if you want to call in, give your thoughts on this, 202-470-0049. What do you think that Congress passed the bill? And now I will say that, let's see. Oh, Paul Spalding wrote in, Paul, you said Obamacare is just far out of the ballpark. I just can't afford it for my wife. So your point, Paul, is that under Obamacare, your rates have gone up too much, and you're hoping under a new health care replacement bill, your rates will go down so you can actually afford it. Thanks, Paul, for writing that in. So we want to hear what you think that now that they've passed this bill. And as I said yesterday, when the first health care bill was withdrawn. They said they were going to vote on it, and then they didn't. It was withdrawn. So many people came out and said, this White House stinks. Ha ha, this administration, they don't know how to run anything. They're amateurs. That was only a month ago, and now a month later we have a bill that was passed by the House, regardless of what you think on the bill. So will these critics, will we hear them take back their words at all? will they now say, oh, I guess I was wrong? Maybe the White House is being better run than I said it was, a month ago. We'll see, but that's a thought I have.
Garrett in the chat room said, "This will open interstate competition. This will take a little time to build up the steam, but overall will be good for the vast majority."
So you're happy about this, Garrett. You think it's going to, for one thing, you say it's going to open up interstate competition. Now, as I mentioned before, that's not in the bill. That's something that has to be done via, I believe, the Health and Human Services Department. So I think and now what I'm confused about, though, is I do know that there's something in the bill itself, in the original Obamacare bill, that in theory allows for interstate competition, but the executive branch has to do stuff, and they didn't do it in the Obama administration. What I'm a bit confused about is, could President Trump have opened up insurance to interstate competition even if a replacement health bill wasn't passed by making certain changes? I'm not sure about it, but he also might be waiting to do that. Even if he could do it without a replacement bill, he might be waiting to do it for the replacement bill to pass first. I need to read up on all of this. So, oh, wonderful. Teresa, Miss Tree, I hear you were on the line from Massachusetts, I presume, correct?
Yes. Hi, Steve.
Thank you. It's nice to hear your voice in person. I know we see you on the chat room all the time, so thank you for calling in. And do you go by Miss Tree or Miss Teresa on the phone, or Teresa on the phone?
I go by Miss Tree, but I'm Teresa, and everyone used to call me Tree, so that's why I'm Miss Tree.
All right, well, we'll call you Miss Tree on the phone. So, Miss Tree, thank you for calling in. What do you? I assume you wanted to talk some about this, your reactions to this bill being passed.
I'm just really thrilled that Trump is doing what he's supposed to be doing. He's just getting everything done, and I was crying because I had been praying, and I'm just really happy to hear that he's doing what he, said he was going to do, and that it's just amazing. I think this is the first president that we've had in America since Reagan, and that was a long time ago for me, So I just, Steve, you're doing a great job. I just want to thank you all, for all this work. It's just fantastic.
Thank you so much, Ms. Tree, and thank you for being in the chat. I know you're in the chat room all the time, and you help keep the chat going there, and you're always writing to us at Right Side and supporting us. So we really, all the support of the viewers, we wouldn't be here without you, so we really appreciate all your support. So thank you so much.
Thank you so much. Yeah, thank you. Yeah, I love to just, help out, share the show, because you guys are great. I really love you guys, and I just want to say thank you so much for today.
Thanks very much. I hope you call in again sometime.
I will, Steve. Take care, and we all make mistakes, so don't worry about that.
Thanks, Miss Tree. Well, I won't make that one again, but thank you. So that was Miss Tree, and Miss Tree was saying she was very happy because President Trump, she feels, he's keeping his promises. He made promises, and he's keeping them, and he's doing what he said he was going to do, and she was very happy about that. So we appreciate Miss Tree calling in. If you would like to call in, 202-470-0049. You can also reach out to me on Twitter at Lookner, at Lookner, or direct message me, or email me, steve.lookner@rsbn.tv. Again, we're covering this breaking news that the House has passed a bill to replace Obamacare. Now, that the bill doesn't become law. The Senate has to pass their own bill now, see if they can pass their own bill, and then the House and the Senate will have to get together and see if they can make a compromise bill out of their two bills, and then they'll both have to pass that compromise bill. So we have a long road to go in terms of getting a new law, but there's a first step, and it's an important step for the Trump administration. It's under President Trump. It's the first major piece of legislation that's passed one of the houses of Congress. So I'm sure President Trump feels happy today about that, and he put a Okay, cool. And President Trump put a lot of his time and effort in the last few days into meeting with congressional representatives, talking to House members on the phone. So President Trump did put a lot of effort, personal effort, into this, and he must be happy right now. So we have, I think Francis is on the line right now, correct?
Yes. Hello?
Francis, how are you? Where are you calling from today?
I'm calling from Pennsylvania.
Great. Thank you for calling, Francis. So what are your thoughts today on this health care bill being passed?
So I think that it's a good idea, but I also was thinking about kind of like welfare terms, and that like only like poor people get it, and like they're taking advantage of it. And I was hoping that people won't take too much advantage of this healthcare bill, and that I guess like if you're not working for it, I don't think it's fair. And I'm sure there's people that are really trying to work for it, like that really work hard, like really long work weeks, and I was hoping that there's like some fairness in it, I guess.
Right, I see what you're saying. So now I am not aware, Francis, right now of there being any kind of like provision in there now, like a work requirement to get this coverage. But at the same time, I understand your view, which is you're saying like you feel that if people are going to get a benefit like this, they should be doing certain things as a citizen. And you're saying like, actively trying to get work to be able to get it. And it's, it's a tough thing with benefits because on the one hand, you want to give it to people who don't have a lot of money. But on the other hand, you don't want to give it to people who aren't like you might think, well, people need to put forth a certain amount of effort to get this. And I know this comes up with welfare itself where, it's often discussed what kind of work requirements they should have and that those kind of laws get changed and whether there should be work requirements. And so I think, I respect your view on this and I understand where you're coming from. But I will say as of right now, I'm not aware of work requirements being put into this. I will say this, however, an argument that one might give for not having any kind of work requirement is they might say something like this. They might say, well, look, let's say somebody doesn't try to work and they just sit at home. If they get this health insurance, maybe at least it'll cost the rest of society less. Because even if the person sits home, if they have insurance, they might get treated earlier for some disease and the disease won't cost as much to treat than it would cost if they didn't have insurance and they didn't catch it until the disease was much farther advanced. And what will happen because of that is since the government was going to pick up the tab anyway, the tab will be less. So it's a good thing for everyone if this person has insurance, even though they're kind of sitting on their butt not trying to work for it. I'm not saying that view is right. I'm just saying that would be an argument somebody might give for getting this benefit to as many people as possible. But I understand your view as well, which is you think that if people are going to get benefits from the government, specifically this health bill, they should, there should be certain requirements on that. And you shouldn't be able to sit just to like do nothing and not try to get work, or I would assume you might also think people shouldn't blow their money on unreasonable things and still get more from the government. So I get that view you have, and who knows what changes might appear in the bill coming down the road. This is just the first version, and it's not the final version they're voting on. But I appreciate your feedback and your view on this, and I'm sure other people out there share your view. Is that all you wanted to say, Francis, or were there other points you wanted to make?
I think that was it. Thank you.
Great. Thanks so much for calling in. Really appreciate it. That was Francis from Pennsylvania. If you would like to call in, share your view on the health bill, on it passing today. What do you think? 202-470-0049 is our number. Or message me on Twitter at @Lookner, or email me at steve.lookner@rsbn.tv. And we're going to bring you, hopefully, I hope we can bring to you the Rose Garden ceremony if we're allowed to carry it, so we'll try our best. Kerry Nelson wrote in, the House Care already happened and the bill passed with 217 votes. Yeah, you wrote me when I was taking a break, and I realized, Kerry, that there was a little mess up by me here, and I missed exactly when it happened. Let's see. Aaron Robinson, you say, don't forget that Obamacare was repealed in the House twice before, and the House and Senate repealed Obamacare once last year, but of course Obama vetoed. So, you're talking about that there have been other repeals before. So, and you want to just give people a heads up that to not forget this. Yes, thank you, Aaron. Okay, cool. So Sayori is on the line. Hello, Sayori. Where are you calling from today?
I'm calling from New Orleans. How are you?
Thank you for calling in, Sayori. So, what are your thoughts on the health bill passing?
Oh, well, let me tell you why I'm so happy this happened.
Okay.
It's really important to me. I have a very good friend of mine. This woman has no income. She she has multiple health problems, and Medicaid will not pay for the surgery she needs. She's got spinal injuries, okay, and it's getting worse to the point where she could maybe ending up paralyzed. And if she does not get the surgery to decompress the nerve, she's going to end up being paralyzed in a wheelchair. I mean, the doctors have told her this. And here's the problem. She was on the Obamacare before, and because of she has no job, she can't work, and she's on very limited SSI and disability. But because of some tax law, some tax snafu, that she has to make so much in order for her to get the Obamacare. They denied her the coverage. This is what Obamacare, they denied her the coverage, even though she has no job and no income, and they said, oh, well, it's for people that have no money. That's crap. Excuse me. But, you know, and now she's in constant pain, and she's left without any option whatsoever. And you know what? I'm so glad. I hope they just cut this thing in half.
So, Sayori, it sounds to me like you're saying you are not a fan of Obamacare and you want to see it go away. Now, I'm not sure because I don't know the exact specifics of your friend's claim, and we don't know exactly if a new bill gets passed, what exactly that bill will be yet. So I can't specifically say right now at this point that a new bill would address your specific friend's issue, but I will say this. It sounds to me like you're saying Obamacare is not working, in your opinion, and you think your friend is an example of this, and so you're happy to see this bill pass, which takes a step toward getting rid of Obamacare.
Yes, sir, I sure am. I really am. And you know what? I think, honestly, you know, unlike Obama, who just, you know, he stuffed a whole bunch of other things into it, it was never meant to take care of anybody. All right. I mean, look how many insurance companies dropped out of the whole thing. And I mean, I think there's one left, maybe. So I work in the health. Yeah, I'm sorry.
Keep going, Sayori. I'm sorry. Keep going.
Sure. I work in the healthcare. I work at a hospital, and I mean, you know, it's not helping anyone. I mean, my God! First of all, you have to pay. You have to make the deductibles, which are out there, way out there. Secondly, in order to make a deductible, I mean, you would have to take the lowest coverage they offer with some ungodly out of pocket, and then you have to pay that. Well, I mean, where does it help anybody?
So, Sayori,
I mean, it's.
Oh, yeah, the point you're making right now, this is a point, just to mention this, Sean Spicer was making this exact same point. He's made this repeatedly in White House press briefings, and what Sean Spicer says is he says, look, just because you have a card doesn't mean you have coverage. And he was saying that the administration feels that under Obamacare, fine, people get their insurance cards and they get quote-unquote covered, but as you're saying, with a lot of people who get covered by Obamacare, they have very high deductibles, they have very high out-of-pocket expense limits, and what happens is you have this insurance, but it doesn't do you any good because you're spending so much of your own money to take care of things, and basically all it is like catastrophic insurance that only helps you if you like end up spending like this crazy huge amount, but for the average person, it doesn't really help them because they're spending so much out of their pocket, and you're pointing out that in your experience you feel that Obamacare insurance you feel has it's coverage without really being coverage is what you're saying.
That's right. And you know what it really amounted to? The people who really couldn't afford it, they ended up having to pay this tax penalty. You know what it did? All it did was it was basically stealing money from people. That's all I see it. Okay? And really, you know, we have, I mean, for people who don't have insurance, who don't have jobs or gainful employment, that Medicaid covers for that. You know, I mean, it's not something I would wish on people. I would wish that everybody would be able to get insurance in the fair market, you know, and be able to afford insurance that isn't gouging them, you know, out of house and home. I mean, you know, even working, like I said, my employer, I still have to pay a good chunk out of my paycheck for it, you know, for my biweekly deductibles, excuse me. You know, but what I'm saying is that this, you know, I remember how in the beginning they said, you know, this is going to be the Affordable Health Care Act scheme. I remember that word scheme quite a bit coming up. You're right, it is a scheme. It's a scheme to get people, you know, to pay into something that wasn't going to pay back. That's all it ever was.
Well, Sayori, I think, you raise a lot of important issues that I think a lot of people have in the country about healthcare, and it's an issue that's not going away. Everybody needs it. It's expensive, and you sound, at least, you believe that Obamacare was not the right way to go, and that maybe President Trump will come up with something that works better for you and your friends. And I hope that's the case. I hope if we have a new bill, it works better than the old bill. So that would be great.
I hope so too.
But
I'm still a little bit apprehensive because, the globalists are so involved in this. I mean, directly or indirectly, they're going to have their hand in this one way or another. But I'll tell you something. I would rather Trump than Obama any day doing the new health care bill.
Right. Well, I really
if I had a choice, that's where it is.
So, I really appreciate your view and your calling up, and you're sharing your experience, your personal experience with all of this.
Thank you, sir.
I very much appreciate it.
Thank you so much.
Have a great day, Sayori. Thanks for calling in.
Yes, sir. Thank you so much.
That was Sayori from New Orleans calling in, and she is quite happy that this bill got passed today because she is not a fan of Obamacare.
Steve, I'm going to butt in. Looks like CNN is going to be covering the. It says Trump Republicans speak in the Rose Garden. I'm checking to see if we're able to carry that. So far, I have not been able to find a legal footage for us to use, but I will keep looking. But just to let everybody know, there's supposed to be a press conference from the Rose Garden.
Thank you, Jake. And one other thought here, Jake, is there's a world in which our feed, we can't get it live, but we can. I'm guessing even if we can't show it live, we'll be able to show it after. I'm not sure about that.
That's correct. We should be able to post it if we can. Yeah. But so far on the site, I have not been able to find it.
Okay. All right. So we're looking. We are looking. Let me see. I want to get to your messages. GSB.UK, who jokingly said I was fired before, said, "Hey, Steve, you're the best. You're still the best. Great entertainment as always. Thank you, GSB.UK. Again, my apologies. I'm so sad. I wanted to count the votes as they happened, and I missed it because my computer froze, and I was looking at an old frozen screen that said House votes soon. Anyways, now it won't happen again. Barbara Braley writes in, so happy, Steve, for the win today. The first step toward working on this issue resolved. As a CPA, I saw the negative impacts on tax returns for even the people who chose ACA if they did not report correct income. So, Barbara, you are happy with this, well.
Zach C. donated $10.
I have been directed by the Senate to inform the House that the Senate concur in a House amendment to the Senate Amendment to H.R. 244, an act cited as the Consolidated Appropriations Act of 2017.
Thank you. Gentleman from Illinois may proceed.
Thank you very much, Mr. Speaker. How much time do I have?
46 minutes, sir.
Oh, okay.
Don't feel obligated.
I know that Congressman Rush has extolled the virtues of Father Clements sufficiently, and I certainly won't need 45 or 46 additional minutes to do that. But I can tell you that Father George Clements is an exemplary, extraordinary, unordinary man, a priest of the highest order, but a man who adopted 4 sons. And he has just been tributed, not only here, but certainly back in our hometown of Chicago, Illinois. And the thing about his 4 sons that he adopted, being a single priest, that was not the easiest thing in the world to do, but all 4 of them have become outstanding individuals every place they have been throughout America. Father Clements not only saved my colleague at a time of great peril and a time of great need, which demonstrated tremendous courage, but down through the years, he has continued to provide creative leadership and great initiatives, especially as related to children and the needs that they had. One church, one child.
Oh, sweet, sweet Evelyn, don't talk about Texas. That's where she said goodbye to me. Maybe some might just go back and find the best love this cowboy ever had. Yeah. Don't talk about Texas or Amarillo skies. Don't talk about Houston or them Austin city lights. Don't talk about Galveston or sweet, sweet Abilene. Don't talk about Texas. So don't you talk about Texas or Amarillo skies. Don't talk about Houston or them Austin city lights. Don't talk about Galveston or sweet, sweet Abilene. Don't talk about Texas. That's where she said goodbye to me. That's where she said goodbye to me. Yeah.
We are back here. Sorry, we had to take a little break to reset our camera. It's the breaking news coverage. The House today has passed a version of the American Health Care Act. Isn't it Health Care Replacement Act? It's AHCA, American Health Care Act. I don't believe replacement is in the name of it, but it is the replacement bill for Obamacare. It's not the law yet because the Senate has to vote on a version of it, and then they have to vote on another combined version if the Senate passes their version, so another compromise version. But it is that the House did pass their version of the bill today, so it moves the process along. And it passed 217 to 213. I saw a couple of interesting facts about this bill here.
Before you continue that, Steve, Don Bruno donated $10 and said, "Thank you, Right Side Broadcasting, for being here for us."
Thank you so much, Don Bruno. Really appreciate it. So we do this for you. And we really appreciate when you say thanks. Also, when you donate, of course, because donations allow us to do this for you. But thank you, Don, for writing in. And it's good to hear you're happy with us because we do this for you guys. Yep. Let's see here. Now, a couple of facts about this vote I saw on Twitter. So, Aaron Zitner from the Wall Street Journal, to give you a little more perspective on how the voting went. There were 20 Republican no votes. 20 Republican no votes. I think if there were 23, it wouldn't have passed, but there were 20 Republican no votes. Of the 20, 15 of the 20 Republican no votes were from the centrist Tuesday Group caucus. So those are like some of the most centrist people in the Republican group, of the Republicans in the White House. Sorry, of the Republicans in the House. The Tuesday Group is a very centrist, moderate group of them. 15 of the 20 no votes today from the GOP were from that group. 9 of the Republican no votes were from Clinton districts. 2 of the GOP no votes were from the Conservative Republican Study Committee. And I also saw this as well, if I can find it. Mark Murray from NBC tweeted this out. I thought this was interesting. He said a lot of vulnerable Republicans voted yes on the AHCA today. 14 of 23 Republicans who are in districts Clinton won, 14 of the 23 voted yes on this bill. And of the 35 Republicans in competitive races next year, 25 of those 35 voted yes on this bill. So this bill was able to pass because a majority of Republicans who were in Clinton voting districts or competitive districts, they voted for it. So now, perhaps their calculation was, now maybe they just voted for it because they liked it, but also, there might have been a calculation here which is like, we can't, we know we're going to get some blowback from Democrats in our districts for this yes vote, but maybe they just thought, if I vote no on this and I'm seen as keeping the Republicans from doing something about Obamacare, I might just lose my Republican base. Maybe people were worried about getting primaried. Maybe some of these Republican representatives thought that if they voted against this health care bill, some of these Republican representatives in competitive districts might have thought if they if they voted no on this health care bill, then somebody would run against them in a primary next year, and they would lose the primary because the person who runs against them in the GOP primary would say, hey, Republicans, how can you vote for this person? They voted against an Obamacare repeal. So, interesting facts about the vote. We're taking your calls. We're taking your comments here. We're waiting for the, it's supposed to happen soon, I think, the press conference with House Republicans and President Trump in the Rose Garden. Not sure if we can carry that live. We're going to try to. Not sure if we can. By the way, Jake, is there something over my shoulder, or should I center myself more now? Well, I'm good where I'm at. Okay, great. And thank you to Jake Seals for producing today. If you'd like to call in, 202-470-0049. If you'd like to write in, I'm at Lookner on Twitter, at LOOKNER. You can direct message me here. Or you can email me at steve.lookner@rsbn.tv. And let me check here. David Obst writes in, we were talking about what the prez means. Some do not want to vote either way, so they vote. So prez just means present. That's what David Obst says. David, you sent me another email too. We were wondering what PRES meant on the voting screen. And David says, NV means they have not voted yet. Thank you, David. Bill D. Wall writes in. Best part of this vote is the crushed and devastated media all over my Twitter. Thanks, Bill D. Wall, for writing in. Let me check here and see if I can get some more updates. Let's see. Senator Schumer, the Senate Minority Leader, says, nowhere, the GOP health care bill is going nowhere fast in the Senate. He urges the Senate Republicans to not follow the House Republicans' lead. Jim Acosta says he just spotted Paul Ryan entering the Oval Office, shaking hands with some in the room, including Bannon. Big smiles. Zeke Miller has just tweeted out a picture of teleprompters in the Rose Garden, and there is a podium there, so they're getting ready. Mark Knoller reports, through the trees at the White House, House Republicans can be seen arriving on a bus from the Capitol to attend the healthcare vote event with the president. Oh, so I'm seeing this report, and I think one of our viewers, I think it was Susan J. or something, wrote in and said this was true, and I thought she was joking, but I see somebody else on Twitter tweeted. Steve,
I'm sorry to butt in, but we will be able to. President Trump delivers a statement in looks like roughly 27 minutes.
Oh, so we can cover it?
We can.
We can.
Yes, I'm looking at it now.
Oh, great. So we are going to be able to bring you, apparently, President Trump's statement from the Rose Garden, which I think, Jake, we might also see some House Republicans speak too. And supposedly that's going to start in about 27 minutes.
Yes, I have to set it up. I'll be back.
Great. We will be carrying that for you live. So coming up here at Right Side Broadcasting, we will bring you live from the Rose Garden President Trump's statement after this bill passing. I'm sure he's going to be quite a happy man. And so we look forward to bringing that to you. So I've seen another tweet which said House Republicans were singing na 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 hey hey goodbye after the House narrowly passes the vote. So now, even if I didn't make that mistake and I realized they were voting live, we couldn't have shown that because we weren't showing the audio from. We're not allowed to just rebroadcast the House vote, so we were not broadcasting the audio when we showed you a couple clips of that vote. But supposedly it was happening. Very interesting. Who is this person that tweeted that? A journalist who tweeted it out. Let's see if I can get other updates here. Oh, I have a message. Aaron Robinson, you sent me a message on Twitter. You said, the Republican-backed American Health Care Act still must be debated in the closely divided Senate, yes, where formal debate isn't expected to begin until June. So you're saying, so this process, thank you, Aaron. So Europe, from what you've read, this debate in the Senate isn't supposed to start till June. So yeah, this could take a while. are back. We're waiting for President Trump to speak at the White House, along with House Republicans, in the aftermath of their passing a replacement bill for Obamacare. They did that today. It's not law yet, but their version is passed at least. And we're going to go to that as soon as it happens. We will show that to you. Sorry we were off. We had a couple of camera issues today, so we were just off for a few minutes. And while we were off, though, we got a donation, Jake. Who is it again who gave money? Jake? Gene Cooper? Oh, Gene Cooper. Thank you, Gene Cooper. Gave $50. Really appreciate it, Gene. That's very nice of you. Because we rely on you guys to stay on the air and to bring you such coverage. So your donations are very much appreciated. I know that right now I'm getting some updates about what's going on at the White House right now. I do know that the House Republicans, they're kind of, a bunch of them are behind a podium at the White House. They're waiting for President Trump. We'll bring that to you live when it happens. Zeke Miller reports he spotted Paul Ryan and Steve Bannon standing in the Oval Office. The Ivanka and Jared Kushner will also be at the briefing I just saw, at the press conference. What else do we have here? Any other updates here? So we'll be covering that right when it happens, bringing it to you. If before that you'd like to write me and give your comments on the events of today. We're going. Enjoy the press conference.
Ladies and gentlemen, the President and Vice President of the United States.
Speaker Ryan, Majority Leader McCarthy, Majority Whip Scalise, Chairwoman McMorris Rodgers, Chairman Brady, Chairman Walden, Chairwoman Black, Congressman MacArthur, Congressman Meadows, and all the principled members of Congress who are standing with us here today, on behalf of President Donald Trump and the First Family, welcome to the White House. And thanks to the leadership of President Donald Trump, welcome to the beginning of the end of Obamacare. It was March 2010, 7 years ago. Democrats passed a government takeover of health care. And at that time, Republicans in Congress promised the American people that law would not stand. Today, thanks to the perseverance, the determination, and the leadership of President Donald Trump and all the support of those gathered here, we've taken a historic first step to repeal and replace Obamacare and finally give the American people the kind of health care they deserve. So today, with heartfelt gratitude for all he has done to keep his word to the American people, and for all he will do to continue to make America great again, it is my high honor and distinct privilege to introduce to you the President of the United States of America, President Donald Trump.
Thank you. Thank you. Thank you, Mike. That's the group. Thank you. Thank you very much. This really is the group. What a great group of people. And they're not even doing it for the party. They're doing it for this country, because we suffered with Obamacare. I went through 2 years of campaigning, and I'm telling you, no matter where I went, people were suffering so badly with the ravages of Obamacare. And I will say this, that as far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident. Your deductibles, when it comes to deductibles, they were so ridiculous that nobody got to use their current plan, this non-existent plan that I heard so many wonderful things about over the last 3 or 4 days after that. I mean, it's I don't think you're going to hear so much right now. The insurance companies are fleeing. It's been a catastrophe, and this is a great plan. I actually think it will get even better, and this is, make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it. Make no mistake. And I think most importantly, yes, premiums will be coming down. Yes, deductibles will be coming down. But very importantly, it's a great plan. And ultimately, that's what it's all about. We knew that wasn't going to work. I predicted it a long time ago. I said it's failing. And now it's obvious that it's failing. It's dead. It's essentially dead. If we don't pay lots of ransom money over to the insurance companies, it would die immediately. So what we have is something very, very incredibly well-crafted. Tell you what, there is a lot of talent standing behind me, an unbelievable amount of talent. That I can tell you. I mean it. And, you know, coming from a different world and only being a politician for a short period of time, how am I doing? Am I doing okay? I'm president. Hey, I'm president. Can you believe it, right? I don't know. I thought you needed a little bit more time. They always told me more time, but we didn't. But we have an amazing group of people standing behind me. They worked so hard, and they worked so long. And what I said, let's do this. Let's go out, just short little shots for each one of us, and let's say how good this plan is. We don't have to talk about this unbelievable victory. Wasn't it unbelievable? So we don't have to say it again. But it's going to be an unbelievable victory, actually, when we get it through the Senate and there's so much spirit there. But I said, let's go out. We have a little list of some of the people, and I think after that list goes, if they don't talk too long, our first list, we're going to let some of the other folks just come up and say whatever you want. But we want to brag about the plan, because this plan really, oh. Well, yeah, we may. But we're just going to talk a little bit about the plan, how good it is, some of the great features. I want to thank Paul Ryan. He has worked so hard. And I was joking. I said, you know, Paul, for the last week I've been hearing Paul Ryan doesn't have it. It's not working with Paul Ryan. He's going to get rid of Paul Ryan. Then today I heard Paul Ryan's a genius. He's come along. You know, the groups have all come together. We have the Tuesday group. We have so many groups. We have the Freedom Caucus. And they're all great people. But we have a lot of groups, but they all came together. Really, Paul, I'd say in the last 3-4 days, especially in the last day. I see Mark and I see Kevin. I see so many people, Jim. We just have developed a bond. This has really brought the Republican Party together. As much as we've come up with a really incredible health care plan, this has brought the Republican Party together. We're going to get this finished, and then we're going, as you know, we put our tax plan in. It's a massive tax cut, the biggest tax cut in the history of our country. I used to say the biggest since Ronald Reagan. Now it's bigger than that. Also, pure tax reform. So we're going to get that done next, and this really helps it. A lot of people said, how come you kept pushing health care, knowing how tough it is? Don't forget, Obamacare took 17 months. Hillary Clinton tried so hard, really valiantly, in all fairness, to get health care through. Didn't happen. We've really been doing this for 8 weeks, if you think about it. And this is a real plan. This is a great plan. And we had no support from the other party. So I just want to introduce somebody to say a few words who really has been, I think, treated very unfairly, but it no longer matters because we won, and we're going to finish it off, and we're going to go on to a lot of other things, and we are going to have a tremendous 4 years, and maybe even more importantly, we're going to have a tremendous 8 years, but we're going to start off with just a great first year. And Paul Ryan, come up and say a few words. Congratulations on a job well done.
You get thick skin in this job. Thank you. Thank you, guys. Thank you. First, thank you, Mr. President. Thank you. Thank you for your leadership. There are too many people to name who played such an important role in helping us get to this part. But I want to thank a few people in particular. I want to thank Chairman Greg Walden, Kevin Brady, Diane Black, Pete Sessions, and the members of their committees for all the hard work they put into getting us to this point. I want to thank all the other members who contributed to making this the best bill possible. It really was a collaborative, consensus-driven effort. I also want to thank the team here at the White House. I want to thank Tom Price. I want to thank Mick Mulvaney. And I especially want to thank Reince Priebus. We could not have done this without you, gentlemen. You guys are the best. Of course, this would not have been possible if that weren't for these two gentlemen behind me. This is the fourth presidency I've served with. I have never, ever seen any kind of engagement like this. I want to thank Mike Pence, and I want to thank President Donald Trump for their personal involvement in working with our members and working to get this right, for getting this done and getting us to where we are. Thank you, gentlemen. Today was a big day, but it is just one step in this process, an important step. We still have a lot of work to do to get this signed into law. And I know that our friends over in the Senate are eager to get to work. They are. We're going to see that work through. You know why we're going to see this work through? Because the issues are just too important. The stakes are just too high. The problems facing American families are real. And the problems facing American families as a result of Obamacare are just too dire and too urgent. Just this week, we learned of another state, Iowa, where the last remaining health care plan is pulling out of 94 of their 99 counties, leaving most of their citizens with no plans on the Obama market at all. What kind of protection is Obamacare if there are no plans to choose from? And this is a trend that we are seeing all across the country. The truth is, this law has failed and it is collapsing. Premiums are skyrocketing and choices are disappearing. And it is only getting worse, spiraling out of control. And that is why we have to repeal this law and put in place a real, vibrant marketplace with competition and lower premiums for families. That's what the American Health Care Act is all about. It makes health care more affordable. It takes care of our most vulnerable. And it shifts power from Washington back to the states and, most importantly, back to you, the patient. Like I said, we've got a lot of work to do. But one thing is now clear. Republicans are committed to keeping our promise to lift the burden of Obamacare from the American people and put in place a better, more patient-centered system. It is my pleasure at this time to thank and to welcome to the stage someone who helped make this so possible, our very talented Majority Leader, Kevin McCarthy.
I remember the very first time I came down here to see the new president, President Trump. We talked about health care. You know what the president said? He said, let's not make this partisan. Don't do what you think is right for the Republican Party. Do what's right for the American country. And today, that's exactly what we did. You see, if you simply read the papers from this week, you take politics out of it, and you put people before politics, how do you look in the faces of 94 counties in Iowa out of 99? Or not that they won't have very many choices, they'll have no choice. How do you care for pre-existing conditions when there's no care at all? Or you read the paper yesterday and you look at Aetna pulling out of Virginia, or to Tennessee next year with 16 counties with no care. Or what about those families that paid into those 23 co-ops that Obamacare created with more than $2 billion? 18 of them have collapsed. And the only answer that this American government gives them is a penalty. If you simply look at the facts, more people took the penalty or the exemption than actually signed up for Obamacare. I did not run to this office to promote a party. I ran for this office to make this country better. Yeah, and it would be easy to say no. It would be easy to watch it collapse. But I can't look at those families. I don't think that's right. And that's the exact message I got from this administration. So, Mr. President, I want to thank you. I want to thank you for your leadership. I want to thank the Vice President. You know, I've only been through a few presidents, but I've never seen someone so hands-on. Walk into my office yesterday morning, they say the president's calling again. I pick up the phone. I happen to be the majority leader, the former whip. I know my members well. The president gives me a list of who he thinks I would be best to talk to on the list. And he was right. And Mr. President, they all voted for the bill. Today is a start. Today is the start of a new beginning. Yes, it's about providing better health care. But I happen to have been a small business owner. I listened to my district. You know how many families no longer have a 40-hour job and now have to take 2 part-time jobs? Or how many small businesses told me that they couldn't expand anymore because they were afraid of what Obamacare would do for them? We are going to unshackle, build an economy, let people have greater choice in their health care, and protect pre-existing conditions. And I thank you for that work. I want to call up. I was this job before being majority whip. I never had to go through a bill like this. And I will tell you, being the whip really isn't one person. The deputy whip should get a lot of credit as well. Patrick McHenry. The whip, Steve Scalise, never gave up, answered every question, and the team between Scalise and McHenry I'd put beyond any team we've ever had. I give you the majority whip, Steve Scalise.
Today, we took the first step toward rescuing families from the failures of Obamacare. We've been seeing it play out all across the country. This isn't some hypothetical discussion. You see families struggling in every part of our country. I hear from families all the time in my district in Southeast Louisiana sharing with me stories of double-digit premium increases every single year. When we had the 27.5-hour markup before the House Energy and Commerce Committee, longest, they said, in the history of Congress, to pass this bill out of committee, we had a long and important discussion about healthcare policy in America and how this isn't about achieving some kind of political goal. It's about families. Families who are struggling under the weight of this law that doesn't work. And so I reached out to my own constituents and I said, share with me some of the stories and how this law, Obamacare, is affecting you personally. And unfortunately, I got a lot of horror stories. You know, we've talked a lot about protecting people with pre-existing conditions in the context of this bill, and there are so many things, multiple layers in our bill that we passed today that not only protect people with pre-existing conditions, but actually focus real targeted money on lowering premiums for families with pre-existing conditions. And so during the committee hearing, might have been around 3 in the morning, I shared a story of one of those constituents, Chris from Slidell, who sent me a letter and talked about their family having pre-existing conditions. They have a family member with pre-existing conditions, and how because of the problems of Obamacare, they're paying double-digit increases. But this is the real story for families that have pre-existing conditions that are truly being hurt by Obamacare. One of the untold stories are the dramatic increases in deductibles. So there are a lot of families across the country that have over $10,000 deductibles. Now, for most people, that means they really can't even use the health care that they have in Obamacare. And so what Chris told me was, not only when we go to the doctor do we have to pay so much for our premium, but almost everything we do, we're paying out of pocket because we've got such a large deductible. So basically, I'm paying a lot of money for a healthcare plan that doesn't work for me. Please provide relief for my family. We hear these stories over and over. And what's been so encouraging about this debate is that from the very beginning, every member of Congress that's been involved in trying to get this bill passed has been focused on two main things. And the first one is lowering premiums for families that are struggling. And the second is making sure that patients and doctors are the ones that make their own healthcare decisions. Unelected bureaucrats in Washington should not have anything to do with the healthcare decisions made between a patient and their doctor. And that ends with this bill. And so as we went through this process, and it took weeks, some people wanted it to take a couple of days, but we said we're going to take the time to get it right because it affects every person in this country. And every change that was made along the way made this bill better. Almost every change that was made along the way was focused on lowering premiums. Of course, you had a lot of other things we wanted to do. We reformed the Medicaid program. One of the most broken parts of healthcare, anybody will tell you, is Medicaid. And so we actually give governors and states the flexibility to go and be innovative and do things that'll, in a much more targeted way, help low-income families in a way that Medicare is failing them today. That's another important aspect of this bill. But we wouldn't be here today without the work and the help of the President and the Vice President of the United States directly getting involved. Because every meeting we had with members that wanted to get additional components added to the bill, President Trump said, bring him into the White House. I want to meet with him. I want to talk to him about how we can actually lower premiums. Because President Trump's focus from the beginning was the same thing. He knows Obamacare fails, but it's failing because it's hurting families. And he said, how can we lower premiums? How can we give patients more control of the health care? And ultimately, all of the meetings that we had along the way that made this bill better were focused on those objectives. And that's why it's so important that we got this first step done today. There's a lot of work left to be done, and I look forward to the Senate taking the action that they need to take, but ultimately getting a bill to President Trump's desk that he'll sign that actually rescue families from this incredibly failed law and put patients back in charge of their healthcare decisions and lower premiums. And the man that led the charge in starting this process in the committee was the House Energy and Commerce Committee Chairman, Greg Walden. I want to bring him up.
Thank you, Mr. Scalise. Ladies and gentlemen, Mr. President, Mr. Vice President, it has been a pleasure and an honor to work with you hand in hand to get this bill to this point. And I want to tell you what a great team you have and what a great team I think we have in the Congress and on the Energy and Commerce Committee and our subcommittee chair, Mike Burgess. Mike, come on out here for a second. Dr. Mike Burgess done incredible work on this as well. You've heard a lot about our goal to get this back to a patient-doctor relationship, to make insurance affordable to every American and available where they have choices and lower costs and competition in that market. It is collapsing around us state by state, county by county. Last year, there were 225 counties in America where you only had one choice on the Obamacare exchange. This year, it's 1,022, and you've heard now there are some counties where you'll have no choice. That's not affordability. That's not access. That's not patient care. That is what we're trying to reform in this legislation. You heard about Medicaid reform. I started on Medicaid reform in the 1989 session of the Oregon legislature. I helped out there. We became the majority in 90. I was majority leader in 91. We continued these reforms to achieve this same goal of trying to get people care that they needed when they didn't have it. And I continue that battle today. We reached out to governors. We reached out to insurance commissioners. We reached out to innovators in this space. Now, I think about Governor Herbert out of Utah, who told us the story of having to petition CMS, the old CMS, not Seema Verma and Tom Price's CMS, to see if he could use a modern, new, innovative technology to communicate with his Medicaid recipients who had that same technology. You and I would know that as email. 9 months later, the government here in Washington denied his request to communicate with people who had email by email. They told him no. And I said to the governor of Utah, how much would that have saved your state? He said $6 million. Now, do you want to spend it in snail mail, on postage, or do you want to spend it in health care? But the bigger question is, why do you have to come to Washington, D.C. to get that kind of permission to begin with? So what this legislation does is open up the ability for states to innovate, for doctors and patients and legislators to get together state by state and make a real difference for the people of Utah or the people of Oregon or the people of Florida. We can get this right. It is our duty. It is our obligation. This is the first step. I look forward to the partnership with the Senate and continuing with one with the White House till we get this signed into law. Thank you. And now it's my great pleasure to introduce the chairwoman of the Budget Committee, the chair who put us on this task, a nurse, an incredibly capable legislator, Diane Black.
Thank you. Thank you, Greg. Some 45 years ago, I graduated from nursing school. And when I graduated, I took an oath of honor to devote myself to those committed to my care. And it is what brought me here to Congress, because I saw almost 7 years ago what this was doing to those in my state. The people who come to me at church, that stop me in the grocery store, that stop me wherever I am at a ball field with my grandchildren to tell me with tears in their eyes, please help us. Please help us. The premiums have gone up. The deductibles are so high we cannot even get the care even if we pay our premiums. It was breaking my heart and has been breaking my heart over those last 7 years now that I've been hearing this. And so this is a great day for us. This is just the beginning. We have the opportunity now to rescue people, to give them the opportunity to truly get the kind of care that they want, they deserve, with the doctors that they choose and a price they can afford. And that's what this celebration is about. It's not about politics. It's about looking those people in the eye. The people that were thrown off of their care in our state, 28,000 people lost their care in our risk program in one day, just like that. And this is a great day. It's just the beginning There's still more to be done. I'm hopeful that the Senate is even going to make this bill better. There's so many people to thank. There are a lot of them are standing back here, but most of all, I want to say thank you to Mr. President and Mr. Vice President for being engaged, for giving an opportunity for our members to feel they're being heard, and at the end of the day, to get a product that's really going to work for the American people. That's what this is all about. And now it's my honor to bring to the podium my chairman of Ways and Means, Representative Brady.
Thank you, Diane. Mr. President, Mr. Vice President, I'm proud on behalf of the Ways and Means Committee, on behalf of our House Republicans, again to say thank you for your leadership. You know, I know this is just a first step, but make no mistake, this is a giant step toward a day, toward the day when Americans aren't struggling under $1 trillion of tax hikes that hurt small businesses, that land on families, that drag our economy down, that hurt patients. Under this new law, it's gone. We take a giant step toward a day when Americans aren't forced to buy health care they don't want and can't afford. And small businesses are no longer forced to offer health care their workers can't afford either. And we take a giant step today to the moment when Americans can save in their health savings plans for those big out-of-pocket costs, and they get a personal tax credit that can go with them from job to job, state to state, home to raise a family or a business, even in retirement if they want. We take that big step so Americans can choose health care they need, not the health care Washington thinks they need. So this is a giant step forward, and I'll finish with this. We know you have some big plans on tax reform. Bold plans. At least we've heard they're great. And I think they are. And make no mistake, today we've taken a giant step toward delivering bold tax reform that leapfrogs America into the lead around the world and simplifies this code like it's never been done before. Mr. President, we intend to deliver on that promise too. God bless. And I'm proud to introduce my friend from North Carolina, the leader and the chairman of the Freedom Caucus, who stayed at the table, worked to bring our conference together, Mr. Mark Meadows.
There are three numbers that matter today: 217, 1, and 318. Today we had a vote in the House that 217 votes actually came together from different districts from all across the country, from Maine to California, from Michigan to Florida, and in between. And all of those 217 members came from different districts that represented a different kind of people. And it's a good day because of the number one, a president who wouldn't give up, a president who got engaged, a president who said, you know, I don't care what the mainstream media is saying, we're going to get this done and we're going to make it better for the American people. And Mr. President and Mr. Vice President, for those late night calls, I'm glad that I'll get some rest. But I want to thank you on behalf of the most critical number, and that's the 318 million Americans who now, once again, will be able to get affordable health care, to allow those decisions to be made between them and their doctor. And once again, make sure that they don't have to go begging and figuring out how to pay for their health care premium instead of their mortgage. So, Mr. President, it's a great day for America. It's a great day for this administration, but it's a truly great day for the American people. God bless. And I have the honor of introducing someone that I didn't know real well before this all happened. And I use the term gentleman in the most appropriate way. The gentleman from New Jersey, my good friend, Tom MacArthur.
Well, thank you, Mark, and hello, friends. I have said from the beginning of this long process that this has to be about people, not about politics. I watched my dad, who I love very much. He's in the latter stage of Alzheimer's now, but I watched him all my life working 3 jobs to pay off medical bills because he had no insurance when my mother died of cancer when I was 4. He paid those bills off when I was in college. I remember the day he called me and told me he had finally lifted that burden, and I was proud of him. I'm very thankful to have had a small part in moving a bill forward that will help every American be able to afford insurance so that nobody has to endure that. Eight years ago, we had a president who faced a really important question. How do we get more Americans insured? How do we help the most vulnerable among us? It's a really important question. And he and his party, for all their efforts, came up with the wrong answer. The answer was, let's have more government control. Let's have more government imposition. Let's trust Washington and not the states. And it's failed. Today we have a president who is facing the same question. How do we make sure that people with pre-existing conditions, the most vulnerable among us, are protected? How do we get premiums to come down for everyone else at the same time? How do we make sure that every American has a chance in this area? And I'm proud to stand with a president who has a different answer, a president who trusts the states and ultimately trusts the American people. So this is a big day. It's a first step, but it's an important step to make sure we keep our promise and we care for the American people, and I'm really proud to be part of that. And it's my, thank you. It's my honor to invite up the director of CMS, the administrator, Seema Verma.
Well, thank you, and congratulations to the President, the Vice President, the Speaker, and all the Republican leadership and all the Republicans in the House. Thank you for what you did today. You know, I've spoken to a lot of moms across the country like me, and they are so concerned about the rising cost of health care, paying for expensive premiums and high deductibles, having an insurance card that they can't use because it's still unaffordable. And what happened here today was an important step towards addressing that problem, so thank you. And for the Medicaid program, I've worked in the Medicaid program for over 20 years. The Medicaid program is our aged, our blind, pregnant moms, kids, disabled, and the poor. These are people that have no other place to go but the Medicaid program. And the status quo in the Medicaid program is not acceptable. We can do better. And the big step that was taken today is a very important stride towards making that program work better, towards giving governors the flexibility to design programs that are innovative and actually improve health outcomes. I'm so excited about this big step forward, and I think it's a great day for our country. So thank you for everybody that was involved in this.
It is really a remarkable day, and it's a day of great victory, not for politics or Washington, D.C., but for the American people. Mr. President, you understand and appreciate the importance of teams and teamwork. This is a remarkable team that is assembled here that is trying to address one of the real conundrums and challenges that this nation has, and that is how to make certain that we are able to provide the kind of quality care for every single American. But great teams don't just come together, they need great leaders. And so I want to thank you from the bottom of my heart for the privilege of being on your team, and thank the Vice President and you for what you've done to date to make certain that this program moves forward. And we've gotten to this point right now because the men and women behind us have acted upon principle. And it's the principle that patients and families and doctors ought to be making medical decisions and not Washington, D.C. It's the principle that our healthcare system ought to be accessible for everybody and affordable for everybody and of the highest quality, and empower patients through transparency and accountability and choices. That's the kind of principle that these men and women act upon. And I know that's the kind of principle that the Senate will bring to the table as they move forward and deal with this piece of legislation. And I can't wait for the day, Mr. President, where we're able to come back to the White House and we're able to gather with you as you pick up that pen and sign that piece of paper that will move us in a direction that will provide for patient-centered health care for every single American. God bless you.
So the journey continues. We will get it done. We will have great health care for everyone in our nation. We have an unbelievable country, But I want to thank the men and women behind me. I want to thank at least some of the men and women in front of me. And of course, I even want to thank the media. Thank you all very much, everybody. Thank you. Thank you very much. Thank you.
Come on in, put his head in that dig in there.
Hey, you three, come on. Hey, come on.
That was President Trump and House Republicans celebrating at the White House in the Rose Garden. Taking a victory lap is how it's being described in some places for their passing of the House version of the American Health Care Act, the replacement bill for Obamacare. And I've heard some people note that it's not often that you see a public ceremony like that for just the passing of one house's passing of a bill. You might more likely see it for once the bill has passed both House of Congress and the president has signed it. But this is I think it's an important moment for the House Republicans and for President Trump, and they wanted to mark it. And now we'll see where this goes. You know, the Senate now has to start debating their own version of the House of the replacement bill. Maybe it'll look very different from the House version. We'll see, and then we'll have to see if that passes the Senate. If that passes the Senate, they'll have to reach a compromise, and then they'll each have to vote on that compromise bill. So we have a long road in front of us of debating the health care issue and debating the health care bill until we see if actually a new law is passed to replace Obamacare. We've been covering this today. We are Right Side Broadcasting. I want to say thank you to all of you for watching. Thank you to people who've donated during the broadcast. Thank you to the moderators for moderating. Thank you to everybody who wrote in your comments and asked your questions and the phone calls. They were all great. I'd like to heard a lot of thoughtful perspectives on this healthcare bill from all of you. And I want to say, please feel free to follow us on YouTube. So in the future, you hear about all of our videos. And click on the notifications bell when you subscribe to us on YouTube. That's what it's called. Also, feel free to follow us on Twitter at RSB Network. On Twitter, you can follow me on Twitter at Lookner, at Lookner. Jake Seals did a great job producing today. You can follow Jake on Twitter at Jacob RSBN Music. And what else do I want to say? Tonight, Nick Fuentes, America First with Nick Fuentes is on at 8 p.m. Eastern. Watch Nick Fuentes. And if there's more breaking news, as usual, we will always come on and carry it for you. Sunday, we will be doing coverage of the French presidential election, Marine Le Pen versus Emmanuel Macron. It'll probably start around noon or 1 Eastern. I'm not sure yet. I got to see what the French election polls schedule is exactly. But we will post it as soon as it posts the start time, as soon as we have it, a firm start time. Hope you join us for that. And that's going to be it here for today from Right Side. And again, thanks all for watching. We enjoy bringing this coverage to you. If you like having an alternative to the mainstream media, somewhere else to go for breaking news, somewhere to see the Trump rallies be covered, where we interview people in line and we talk to people there. We don't just show you a snippet of it. We show you the entire rally. If you like that kind of coverage, feel free to help us out by donating, because we rely on you. Your donations keep us on the air. You can either go to rsbn.tv/donate, or you can click on the $ in the YouTube chat during one of our Right Side broadcasts. Or you can go to www.patreon.com/RSBN and you can sign up to make a monthly donation and you can get cool stuff in return, like mugs like this. Okay, that's it for today for now. We'll see you really soon, whether it's later today or tomorrow. Hope you have a great day. See you soon from Right Side Broadcasting.